All right, today we're going to tackle a really big question. Why is it that some Americans get to live so much longer than others? And we're going to explore this using a pretty unique lens, an AI tool that helps us untangle what is, honestly, one of the most complex problems in public health. Let's dive in.
So first, let's just set the stage. For all its wealth and incredible medical advances, the United States is a country with some deep and frankly shocking health inequalities. It's really like a tale of two completely different lifespans, and which one you get often comes down to where you live and how much money you make. So how big is this gap? Get ready for this. The richest American men live, on average, 15 years longer than the poorest men. Just let that sink in. A decade and a half. That's not some small statistical blip. That is a generation-long gap in the time you get to live. And the story, tragically, is pretty much the same for women. The gap between the richest and poorest American women is a full 10 years. We're talking about a fundamental, massive difference in the basic opportunity to live a long and healthy life.
Now, this isn't just a profound human tragedy. It's also got a massive economic price tag. These healthcare inequities cost the U.S. an estimated $300 billion every single year. So, solving this isn't just a moral issue, it's a huge economic one, too.
So why is this gap so incredibly hard to close? Well, it's because how long you live isn't just about going to the doctor when you're sick. It's this tangled web of your environment, your income, your education, and the very fabric of the community you live in.
And that complexity, that tangled web, is the real challenge, right? When every single factor seems to be connected to every other factor. How do you even begin to figure out what to fix first? How do you find those key levers that'll actually make a real difference?
And just look at the sheer mountain of data that researchers have to sort through. We're talking about everything you see here. Mortality rates, the quality of local hospitals, but also things like smoking habits, poverty levels, education, and even how good the local job market is. It's like a puzzle with hundreds and hundreds of pieces.
Which, of course, brings us to the central question. When you're staring at this incredibly complicated picture, where on earth do you even begin? It's like trying to untangle a giant knot. Which thread do you pull first? This is where you need a totally different way of thinking. So, to untangle this mess, researchers turn to a way of thinking that you probably use every single day without even realizing it. It's the same kind of logic a doctor uses to figure out what's wrong with a patient, and it's an incredibly powerful way to find clarity in chaos. It's called Bayesian logic.
Let's break this down with a really simple example here. Imagine a patient comes in with spots. Now, your starting point, what the chart calls your prior belief, is that smallpox is extremely rare, while chickenpox is super common. Okay, so then you get the new evidence, the spots. Now, the likelihood of getting spots is high for both diseases. So you combine what you already knew with this new piece of information. You don't jump to the conclusion that it's the 1 in a million disease. Your updated belief is that it's just much, much more likely to be chickenpox. And that's the core of Bayesian logic. You're constantly updating what you think based on new evidence.
And this is exactly what the researchers did, just on a massive scale. They built an AI model called a Bayesian network. The best way to think about it is like a giant intelligent web that maps out all those factors we saw before: income, education, healthcare. And it shows how they all influence each other. And it's constantly updating the probabilities as it gets more data, just like that doctor updating their diagnosis.
All right, so the moment of truth. What did this AI actually find after it churned through all that data? Well, it confirmed a few things we pretty much already knew, but it also uncovered some really surprising connections that point toward powerful and maybe unexpected solutions. Okay, here's the first huge insight. The AI found that counties with higher social diversity are 38% less likely to have a big longevity gap between their rich and poor residents. Now, the thinking here is that more diverse communities might foster better social conditions, maybe more social cohesion or different kinds of economic opportunities that sort of act as a buffer against the negative health effects of poverty.
And the second major finding is all about proactive healthcare. The AI found that having access to high-quality preventive care, and we're talking about actual health screenings and checkups, not just visits when you're sick, can increase the probability of women living past 85 by a massive 43%. For men, it's a 30% boost. That's a clear, actionable insight right there.
Of course, the model also backed up what we've known for a long time. Things like smoking rates, education levels, and exercise are absolutely huge drivers of how long people live. And this is really important, actually, because it shows the AI is grounded in reality. Its more surprising findings are built on a solid, believable foundation.
The AI also found other crucial links that help paint a much fuller picture. For example, people in higher income counties are 30% less likely to die in the hospital shortly after being admitted for something serious. It also showed a really strong connection between things like family stability, lower crime rates, and better chances for social mobility, all things that have a big indirect impact on health.
So we've got these incredibly powerful insights, from the importance of social diversity to the impact of preventative care. The big question now is, what do we do with all this knowledge? How do we turn all this data into real-world action?
And this is maybe the most important part. The researchers didn't just write a paper and call it a day. They made their entire model and all of its findings publicly available online. That means any policymaker, any city planner, or any local health official can go and use this tool to see how different policies might actually affect the longevity gap in their own community.
And that leaves us with one final and really critical question. The AI has helped untangle this incredibly complex problem. It's pointed us towards real solutions. The data is here. The tools are available. So what is it going to take for us as a society to finally act on them and close this gap once and for all?